Good afternoon. I'm Dr. Andrea Chisholm, Chief Operating Officer at the Trust, and I'm glad that you're able to join us today for a Business of Practice webinar titled Challenges in Graduate Training and Clinical Supervision, Addressing Concerns and Complaints While Enhancing Training and Educational Experiences. Presenting today's webinar is Dr. Daniel Taub. Dr. Taub is a Trust Risk Management Consultant and a frequent presenter of our risk management roundtables. He is also one of 8 advocates in the Trust Advocate 800 program, our complimentary consultation service that provides policyholders with unlimited and confidential risk management advice. Dr. Taub has more than 30 years of experience teaching graduate and professional level courses on ethics and legal issues, and has served on the APA Ethics Appeals Panel for more than 2 decades. His expertise in ethics, supervision, and professional practice provides an ideal foundation for today's presentation. We hope you find today's session informative and valuable. Please join me in welcoming Dr. Daniel Taub.
Thank you, Andrea. I really appreciate the introduction and welcome everyone. I'm going to switch over to a new set of slides here, and hopefully we'll all be able to see them. So welcome this afternoon, on Friday afternoon. I hope everybody is well. I see some familiar names and faces. It's great to see you here today, and also new ones, and welcome all. Today's topic, as you know from the title, is really related to some of the changes that have been happening in the work that we do as professors, as supervisors, whether it's in a structured pre- or postdoctoral program, or it's your private practice and you've got an intern or a practicum student. And it has become much more of a topic in the literature around teaching and supervision as regards some of the challenges and complaints. And what I'm hoping to provide you with today, this afternoon, are some tools you can use to address those. These are not easy issues and oftentimes require a fair amount of thought and consultation. But I'm hoping to give you some structures and ideas that you may find useful. Okay. The structure for this afternoon will include an introduction to our risk management model and discussing the current context levels, increasing levels of student and supervisee discontent, our era of increased expectations, as well as issues of empowerment and conflict over the nature of the student and professor relationship and supervisee-supervisor relationship. I'm also going to be talking about ethical content and ethical context for our work as faculty and supervisors, and then structures to consider in both contexts. And I'll be focusing on them separately, but there is some overlap. And then I'll end this afternoon before we break for time for questions at 5 to talk about steps towards resolving conflict. So that's the plan for today. And the goals and objectives are to give you some information about what aspects, especially as instructors and academics, that are important to have in syllabi to help assist in reducing complaints, and definitions of, as well as considerations in 3 of those in collaborative agreements, as they're called. And then I would like to have you leave today with at least some ability to identify 2 levels of supervisory informed consent, and 4 aspects, being able to summarize 4 aspects of the informed consent agreement process, and some steps, 3 at least, to informally addressing ethical concerns with supervisees and also by supervisees. So with that as a brief outline for the afternoon, and just as a reminder for many of you, but also for those of you who are new to the Trust, a brief description of our risk management model and our resources that Dr. Chisholm has been kind enough to talk about already our group of risk managers. But I do want to mention that we have a number of resources online available for you, both just to the general public and professionals, but also for those of you who are policyholders. We have increasing material in our document library, which provides sample documents and templates. It's through our resources center and trustinsurance.com. And we have various sample informed consent forms, articles and FAQs about a range of topics, both long-standing topics, but also topics that have emerged in recent years and months. And for policyholders, you have a free risk management book, downloadable in PDF format. And if you prefer hard copy, which I still do prefer myself, then it's a modest cost. But a great resource to have on your virtual or real shelf in case you encounter situations that you have questions about. Okay. The trust insurance also has some policy enhancements. We have deposition coverage and also regulatory coverage for investigations by, for example, the Office of Civil Rights in the Department of Health and Human Services or Medicare. And as Dr. Chisholm referenced before, you also have our Advocate 800 number, and of course our CE issues, or I should say CE resources for you. And this is the group of risk managers if you are policyholders and call, and you're entitled to a 20-minute free call. You're not limited to one if you have a particularly vexing set of issues. And our group includes Liesl Bryant, who is an ABPP forensic psychologist in Florida, Julie Jacobs, who is a lawyer psychologist in Colorado, Stacy Larson in Massachusetts, also a lawyer psychologist, Mark Martinez, who's an ABPP forensic and just received his Master of Laws. He's also in Florida. Joe Scopo in New York as a JD PhD, and as you saw in my bio, so you've been introduced to me. And very much want to acknowledge and extend our whole group's appreciation to both Eric Harris and Jeff Youngren. They both retired technically, and they are advocates emeritus, but much to our pleasure and also just relief, they're still around. They provide some calls, and if a member of our team has not yet encountered an issue, almost always Eric and Jeff have. So they're just wonderful resources, and we really appreciate their continuing to be available for us. Just a brief introduction before getting into the substance of the day to our risk management model. Of late, we have been trying to find some acronyms to use, some mnemonics to help folks remember what the model is. And that's for us as well as for you. And a more recent model is one that we're calling slow and easy. And the model is one that asks us in more challenging situations when our amygdala is firing, when we're threatened, or we have a really complex situation, to slow down. And the idea here, borrowed from, of course, many different parts of the world and everything from stories and myth, but more recently from the Navy SEALs, is the idea that slow is smooth and smooth is fast. And the more that we can take our time in making the more difficult decisions, we believe that it gives us all a better chance to make accurate and helpful, ethical, and well-risk managed decisions. And slowing down can come in a number of different ways, which I'll be talking about briefly here. But the other component, the SL, is slow is smooth and smooth is fast. The O is openness to not knowing, maintaining our humility. Our experiences when we're entering into this field, we're newly licensed, can sometimes feel like we just don't know what we're doing, and we feel overwhelmed by a sense of humility and openness to not knowing. But as we get to be more experienced and senior, our our confidence grows, which is a really good thing, but it can also cause us to miss things, and especially about issues of difference, issues of cultural difference, but in all kinds of ways. And so we encourage folks to maintain curiosity and a sense of humility, that there's no way to know it all, even in the small corners each of us may have been able to put together as subspecialties or specialties. You all know, at this point in history, we were flooded with information, online, AI, you name it. There's just so much in developing information and knowledge, some of which is highly valuable, some of which is okay, and some of which is not useful. And being able to navigate through that can be a challenge. But maintaining one's curiosity is very important. The W is a time-honored method of risk management. It's write it down. And you all know the old saying, if it ain't written down, it didn't happen. But having good documentation, and I'm going to talk about that especially in the context of our work as professors and also our work as supervisors, is very important. As important, I think, as our work with clients and patients. Right? It's a different kind of documentation. We're not treating people. We're not in at least as a trainer and educator. We're not directly in our health care role, but we are in a healthcare adjacent role. So that writing it down is really important. All right. Now, the easy part, which is often not so easy, but part of our mnemonic, slow and easy, is engage and educate in terms of doing informed consent. It's a process, and the documentation is important, and you're going to hear me emphasize a lot of that this afternoon. But the ongoing, both encouraging questions and informing the students and supervisees with whom we work, very important to do. Okay, so having an educative approach to informed consent, and you'll see how that's mirrored as we talk about both syllabi, but also we talk about a supervisory contract. The A in EASY is about the fact that you all are essential. You're the means through which most of the learning, both in graduate school and in practica and internship and postdoc, how it happens, in modeling, in giving feedback, in providing information, all of those things. And so we have to take care of ourselves as the kind of carrier for and container for communicating what it is to be a psychologist, what it is to do this, as I view it, very important, very ethical and morally grounded work. We have to take care of who we are. And that's more generally like making sure you take breaks and making sure you're getting time off and doing things that you enjoy day to day, but also making sure that you are doing that during the day, being attentive to your own experience, your sense of feeling rushed at times, which certainly all of us have had an experience, the pressures we feel as academics. And as supervisors, the fact that we're often remarkably busy. So we have to attend to ourselves and slow ourselves down so that we can pay attention in the moment to what a supervisee might need, or a patient, or a colleague. The S in EASY is a structured decision-making process. And there are many, many different decision-making models for ethics out there, and most of them are quite good. Most include really kind of what I consider a core 5 components in a structured decision-making for ethics, and we also think for risk management. The first is that we have to define the problem, right? The second is that we then generate alternatives. The third, in most of these structures, is that we evaluate those alternatives. We evaluate them in terms of their ethicality, their consequences, kind of the more utilitarian component and risk management component, their potential impacts on clients and patients clinically. Then in the fourth, we select, and in the fifth, we implement. And a number of models have a wise approach that adds a sixth, which is get feedback if you can. It's often not possible to get very solid feedback about the impacts of our decision making day to day. So it is a good aspiration, but it may be tough and albeit very useful. And then the final part of our slow and easy is Yelp. And here I am not talking about the website. I'm not talking about the review site as much as that pervades our thinking nowadays. I'm talking about giving a yell to your colleagues. Reach out to colleagues for consultation. Having ongoing peer consultation groups is so important. And I'm not just a fan because most of what I'm doing nowadays is consultation, although I still see couples and very much enjoy that clinical work. I also take advantage of and use consultation routinely. I saw it yesterday from a colleague and 2 days ago. So I'm a real believer in consulting with colleagues and peers, and when the need arises, experts and risk managers. Those are all ways to help us do slow and easy. Slow is smooth and smooth is fast. So with those things in mind, let me talk a little bit more about our current context as educators and supervisors. Just a handful of years back, 3 years ago, Pettit wrote an article where it was in the Chronicle of Higher Education, where she spoke about the student-professor power dynamic shifting. And as she noted, it's undergone a sea change. The traditional view of faculty members, as she called it, the rulers of the classroom, we get to decide what is taught and how it's taught. Although there's still a good amount of that that's true, the underlying assumption that students defer to us and to our judgment, and as some view it, to professor dominance, that's what has shifted. As she notes, for a confluence of reasons, student attitudes have shifted. For one, what's considered appropriate for a college or graduate school professor to say and do in a classroom has changed dramatically, especially around issues of diversity, race, gender, and other forms of identity, which is a welcome change in my view. But for another, student deference to teachers is not nearly as strong, as she put it, as it used to be. And students can be very quick to judge our choices about what we're going to teach, how we teach it, may view it as harmful or offensive when we see it as quite benign or necessary, or even superfluous to what they need to know. Right? So this shift is not just for undergraduate students. I had some minor surgery not too long ago, nothing to worry about, and I'm perfectly wonderful. And when I returned to the surgeon to have my stitches removed, we were talking and she asked me what I did. And I talked about teaching and consulting. And she said, what do you teach? And I talked about this upcoming workshop today. And she stopped and she said, wow, I mean, it's not only for us physicians who are supervising residents. And then she began to talk about how challenging it was nowadays to supervise residents in their residency, whether it's surgery, as was her case, or rheumatology. So it appears to be a fairly common experience nowadays, right? Now, our students and supervisees seem to be more vocal. And again, that's not a bad thing, okay? But part of that is there seems to be a more willingness and being activated to complain about more aspects of their training, their coursework, faculty, and supervisors. And as a number of observers suggest, and my colleague and friend Dahlia Ducker, who's a social psychologist and has been in academia for I think 4.5 decades now. She is it was really interesting to have a conversation with her where she talked about an increased requirement or expectation for faculty support. And what's also been mirrored in the literature has been an increasing emphasis on consumer rights of students and supervisees, which we'll come back to in a few moments. She also noted that COVID had the impact of placing us as faculty and supervisors as really the primary representatives of educational institutions. So rather than it being somebody at a desk who's in an office who might be an administrative assistant or perhaps a dean or a dean's assistant, it's you and me, because we were the face of the university during much of COVID. And even though we're now back to hybrid and also in person, I don't think that expectation that faculty will be that contact point has changed that much, as Dr. Ducker pointed out. Now, the literature on the complaints that we receive as graduate professors and instructors and also its supervisors suggests that these four themes tend to be relatively common. The first has to do with fairness and clarity of standards around grading and around academic success. The second, and this cuts across supervision and the academic classroom, absent, inadequate, or infrequent formative and summative feedback. And I'm going to get into that in a lot more detail. The third has to do with disability accommodations, not unrelated to concerns about microaggressions in the classroom and in supervision. Right? Now, another aspect of the rise of complaints has been in the academic literature kind of a quite hotly debated idea that educational institutions and training programs are offering a service to which students or through which students are customers, right? And it gives rise to this customer seller or provider of a service. And on the one hand, it surprises me a little bit that that has been so long in coming, because we see it and have seen it now for a while in healthcare and certainly in many other kinds of services. So it gives rise to a somewhat different orientation, again, also including graduate and postgraduate students, all right? Now, that doesn't mean that we don't have our traditional power differential. Faculty and supervisors, have a lot of control over what happens to our students and supervisees. We may not feel very powerful, and I certainly have had that experience as a faculty and a supervisor, but we do hold, even if my subjective experience may be, we do hold a lot of power over their success and their, in fact, entry into this profession. Right? So the formal and informal ways in which we structure our teaching and our supervision, as well as how we handle complaints, can be seen as a method of helping to empower students and do some leveling of the playing field. But this is not a relationship of equals, not in terms of power. And so in that regard, some of the feedback and some of the complaints that students have are going to be inherent in a power differential and incumbent upon us to navigate, to handle, all right? So to me, given the increases in complaints and our ethical requirements, acknowledging that power differential as a starting place is a useful thing to do, right? One way of understanding ethics, and it's not the only one, but one way of understanding just a global idea about ethics in psychological practice, teaching, and research is that we get guidance by our ethics code and in our fundamental principles in how to handle the power that we have, albeit limited. We are not, of course, enormously powerful, but we do have some, okay? and we're granted some authority as practitioners and supervisors and as faculty. Even if the power is not overwhelming, it can cause harm as well as do good. That's kind of the nature. So an ethical approach is one that helps us guide using power in a manner that is respectful and that promotes welfare of the people we're working with, whether as supervisees, students, or patients and clients. And the usual approaches we have, you know, doing good informed consent, maintaining our integrity in the work that we do, setting good boundaries, and routine, fair evaluations of our students and our supervisees. Those are actually enforceable standards in our ethics code, as opposed to the guiding principles of prima non nocere, do no harm, and beneficence, right? And these these guidelines, in my sense, and also our ethical requirements and standards, are the foundation for how we go about doing what we do as instructors and professors and supervisors, as well as researchers. Right? And they also help, I think, in a very concrete way, us also manage the risks and give us pragmatic approaches to, if we use them well, to help prevent, and when we cannot prevent, because there are complaints that we're going to get, we're not perfect, how to manage them and how to perhaps sometimes turn lemons into lemonade, right? So just a sampling, all of you were quite familiar with these, I think, but in Standard 7, 703 and 706, the language about teaching is about accuracy. But basically, if you look at the under A and 3 lines down, we not only have to be accurate in our subject matter to be covered, but also the bases for evaluating progress and the nature of the course. Doesn't preclude us from changing things as teaching requirements dictate, but students have to be made aware in advance. They have to know what to expect. Okay, this is no surprise. Right? Most of us have been doing this for a long time. Even if you're fairly new, as a student, we got this a long time. But in terms of 706, it speaks to the importance of establishing timely and specific, and I want to highlight that, specific process for providing feedback and giving information about that to the student at the beginning of supervision. And then we evaluate our students on the basis of actual performance on relevant criteria. So these are enforceable ethical standards. They're not simply guidelines or, as we see, there are quite a few guidelines available out there, and I'll be citing them. These are enforceable. Now, as related to kind of preventing and addressing complaints or difficulties with a student and challenges, our ethics code, and also for me as a member of a risk management group, as a risk management tool, structure is a very important component. And at the outset of those relationships, so we're not kind of starting with vague structure and then having to create it on the fly, and then we run into a problem, and then that structure we create, and were the students given notice? Did they know what to expect, right? My experience over the years, and especially early in my career as an academic, I was part of a group of colleagues where we would liaison with placements, both pre-doctoral traineeships and pre-doctoral internships. And there was a contract between the institution and the program and the placements, but we would liaison routinely on at least a once or twice semesterly basis for each of the programs. And as a group, we would have these conversations because we meet monthly. We'd have conversations about how it seemed that the programs that struggled the most when students were not doing well were the ones that didn't have a pretty well put together set of structures around handling it. And that goes back for me now over 30 years. in terms of that. I still believe that to this day. And when I talk to professionals in my role as a risk manager as to their experience, struggles handling a supervisee or a student, what we end up talking about often and that the person raises is, well, we don't have a clear set of processes for how we handle this, or we have this, but it doesn't really address this kind of problem. So we can't anticipate everything, to be sure. But there are some common themes that we've run across and that are clear in the literature, clear in both the history of our work as professors and supervisors. So this is all to emphasize how important that initial structuring is, okay? And the intent here is that we articulate our expectations and the circumstances under which there may be exceptions to those particular expectations. And of course, we can articulate those, but following through is in many ways without, when we have agreements and structure and a process we're going through, we have to pay attention to it and follow through with it. Okay. And this was an interesting part of the conversation I had with my surgeon who did the minor surgery. She was talking about how burdensome the documentation process is when any feedback was given to residents in the surgical residency that she was staffing. And she had such a good point because these have to be accessible processes and ones that are relatively easy to understand. So while a lot of what I'm going to suggest may, particularly with supervision, may suggest some things some of you have not done before, and I'm really going to emphasize documentation of the structuring and reviewing of that documentation. I'm also a real fan of keeping the processes as simple as possible, allowing students to voice concerns and feedback, but also our opportunities being frequent to give feedback and to allow us to talk about what not only our concerns are, but also our supervisee and student successes, right? Now, syllabi, and I'm going to start with academic structuring here. Syllabi are time-honored. These are the methods we used for structuring classes. And they become much more kind of, in some ways, uniform in terms of expectations by universities, even across universities. But what I would encourage you to take a look at as faculty, and I've found this to be really helpful in my later years of teaching full-time. There was a teaching excellence center, and Dr. Ducker was one of the folks who ran that, and they would do these trainings. And while I would often have my own strong opinions and say, here's what I disagree with, I almost always walked away with something of value. So these are some resources for you in your slides. They include UC Berkeley, Cornell, Harvard, Stanford's teaching and learning centers for models for syllabi and templates and processes and requirements. So I'm not going to go through all the vagaries of putting these together. Anyone here who's even started teaching knows when we begin a class and we're starting to prepare, developing the syllabi is one of the heavy lifts that we have. This is not an easy, teaching is not an easy profession by any stretch. Interestingly, there's been an increasing frequency of the use of AI in generating syllabi. Okay, you can find many, many templates. A caution about that, some of them, and actually many, give you some great drafts, but please be very careful. You got to review these. I've seen some things that if they hadn't resulted in problems, would have been purely laughable to have in a syllabus. So please check, because AI is also not perfect by far, okay? Now, there are some particular elements of syllabi that I want to focus on, okay? And educational researchers and observers have noted that there are some methods of preventing, and if they occur, handling complaints that we can build into our syllabi. Now, for some of you here, or maybe even many of you who are faculty now, your universities may already have some structures in place that you're required to put into your syllabus. Great. We are required to know what they are. We should not just assume that's going to be for the dean of student affairs, excuse me, to deal with. But these are especially important in addressing student complaints regarding fairness, bias, grading, unclear or limited feedback, or disability accommodations. So I'm going to spend a bit of time on those, okay? And so we can use AI again just to repeat myself. I had a wonderful gymnastics coach earlier in my life who used to say repetition is the mother of skill. And I think it's true, particularly if the repetition is accurate as opposed to inaccurate. We can learn the wrong things rather than the right things. So the academic structuring that I'm talking about here, specific to issues of complaint and addressing concerns if there are allegations of bias, which may or may not be true, right, is to start with having very clear standards around grading. Well, of course, we're supposed to do that, right? But a description of those activities that the students do for which credit is granted, and then how we assess them. And it's also very time honored to use rubrics. This can be tough and it's a lot of work to put into place, but we got to follow them if we create them. So, for many of us in smaller graduate school programs or smaller graduate school classes, you may have 3 or 6 or 12 students at most. How are you going to value class participation? What is it you expect? Are you going to use quizzes? What's the standard? What's the cutoff? What happens if the person doesn't meet the cutoff? If you're going to do examinations, how much do they count? The basics there turn out to be very important because, interestingly enough, this is the basis for a good proportion, not the majority, but a good proportion of complaints against faculty that either the syllabus was not descriptive and setting the clarity about expectations, or it was not followed, right? The structure and the follow through, right? So if you're going to lay out timelines for when something is due, if you're using that, or for reading, or for particular activities or presentations, create and then follow your criteria for grading, okay? Simple to say, sometimes not so easy to do. You and I open ourselves up to sometimes valid accusations of bias if we don't follow our own criteria. Now, I'm going to get to exceptions in a little bit, but this is the theme that I'm going to have for this afternoon, okay? That we create structure and then we follow that structure. That does not mean we cannot maintain flexibility. In fact, I believe in building that in, but the follow through is going to be important, okay? Now, similarly, the other set of complaints that happen with some frequency, both undergrad and graduate, is having a system of tracking performance where we are able to demonstrate to students and to administration and to a critical viewer that we provided feedback, that we gave the evaluation that we promised. So that tracking process, most of us who've spent a few years or even less than that teaching, either part or full time, know that we have to have some documentation of how we do grading. But when it's missing, and sometimes it does go missing, that's where the problems arise. So here again, this is that notion in our risk management model of slow, that write it down, okay? Really important. Now again, the criteria for evaluating activities, the more we can ground those in observable actions or observable behaviors, statements, activities by a student, the better off we are. That's not always easy to capture, a student's paper, which is simply not very coherent, sometimes it can be really difficult to kind of find a way to give feedback that actually speaks to what the problem is. Um, and having reviewed a dissertation or two in my time and being responsible as a chair, I'm well aware that kind of criticism sometimes is what I would call soft criticism. It doesn't have observable behavior that I can point to, but rather issues and conceptual issues that people might argue about. Nonetheless, the more that you and I can articulate in our feedback and our statements about how we're going to evaluate what the criteria are, and then we use them. We set it up and we sit and we look at those criteria as we read through the paper or we evaluate the student's presentation or PowerPoint, right? Now, the other thing that turns out to be, it's pedestrian but really important, is having your own policies about things like lateness, absences, early departures from class. Most of the classes I taught throughout graduate school and, over a quarter of a century of teaching in a grad program were fairly small. I had less than 20 or 25 students, and there were exceptions to that. And dissertation development classes were 6 students, maybe 8. The ethics and law classes that I taught every year didn't usually have more than about 15 students, 12 to 15. So they were small. So it was sometimes shocking to me to have students get up and leave a class, particularly in recent years, 15 minutes before the class. They don't say anything to me. They just leave. So I need to have some structure around that, even though it may not happen that often, because I've got to be able to say, well, you need to be here for the whole class. Or if you're not requiring attendance, that's up to you. But what are you requiring? And if you're going to require attendance, do you give a break for absences or not? And again, this is really dependent on your own teaching style, your own sense of what you need to assess a student's success or lack thereof, right? The other piece, and I'm going to return to this in the next slide, has to do with issues of how, well, actually, I've moved ahead of myself a little bit here. What are the effects of those behaviors, if any, on credit or grading? So one of my colleagues to us a wonderful description in their syllabus that I then incorporated in one of my own a number of years into my career as a teacher, was that she said, if you have to miss a class, that's fine. You can miss up to 2 in the semester. It will not have any effect. But not only is the content of this class important, but also your engagement and your support of colleagues and they of yours, of your development. So if you miss more than 2, here's what will happen. It will reduce a grade or take off X number of points about all the points that are given for the semester. I found that really helpful because earlier I had just had this hard and fast, you have to attend, student would miss, and I didn't have the specific statements about what the result would be regarding grades. Now, to get back to what I was mentioning, can they use AI? Okay. And are students going to use it? Of course they are. Major issues right now, there's an enormous amount. There's a little literal tidal wave of information about AI and in classroom and teaching. We'll come back to that in a moment, but define plagiarism, talk about it with students, and also give your definition of what they can get extra credit for and how much and for what, okay? Because what we want is, are they demonstrating mastery and competence of the material at a graduate level? And this fits in, of course, expectations for credit. What credit will they get? What credit will they not get for things? How will they be evaluated? Am I going to evaluate the student and say they participated because they asked a question in class? I can, that's okay. Or do I require more? Should they be involved in brief discussions? Are they expected to do a more formal kind of presentation? You get the picture. Many of us require APA style writing in papers and projects, and of course in dissertations. And so be very clear about what you will and won't accept. Having personally labored over more than 150 dissertations in my time, I think over 100 chairs, which is obscene, it became clear that I could spend most of my time as a grammar instructor, or I could try to stay focused on the content and explain and describe to students how I would approach the conceptual components and the research components. So just as an example of a policy here in terms of drafts, saying, I don't require, if you're doing a first or second draft, that you meet all the requirements for APA. And I'll give you some feedback, okay, on papers. But for a final product, I'm expecting that you will meet APA standards. So this is just, just to give you a gist of something to consider. If I review your term paper, your project, your draft, your dissertation draft, and after the first few paragraphs, saves a lot of time here, it's clear that there are too many spelling, formatting, APA style, or grammar problems, I will not read further. Instead, I will hand your paper back to you for grammatical and stylistic corrections. You're allowed to submit to me one time, depending, you could do more than that, without any penalty. However, if the next draft is not clearly improved, I'm going to ask that you get editorial help. That could be with the university tutoring service or resources, and I want to have documentation of who your tutor is. One of my colleagues recently said to me, is it okay to have your student use an AI grammar tutor? Yeah, you can say yes, or you could decide not to. Okay, I don't think there's a hard and fast rule about that. There are some issues with AI and grammar. It tends to be overly, rigid at times, but it can be very helpful. Now, that's the challenge at times with APA style, but make sure you're clear about what you will be accepting and what you won't. Now, to go back to AI, this tsunami of commentary and emerging policy development about AI in higher education, the central concern, of course, is academic integrity. And, plagiarism software like Turnitin and so forth, they have their place, but they also tend to have a high false positive rate, right? So you'll see many different proposals and policies about this. And there are many different approaches, but a substantial agreement across universities, and I've given you 4 different samples here and links, that we have to train ourselves in the use of AI and then our students and give them really clear guidelines. What is appropriate and what is not appropriate? Yeah. In terms of the graduate students, they're using it a lot. It just is, and this is a major issue. And even though our graduate students, we might assume that they have a pretty good understanding of plagiarism, my experience speaks otherwise, and yours may be different, all right? Very important to have a policy about this. The samples that I've given you here are from different teaching and learning centers. There's the Carnegie Eberly Teaching and Learning Center, and they have possible academic integrity policies regarding AI generative tools. Columbia University has a generative AI policy that's more global. Duke's also has an AI policy, as does Stanford. And so if you don't have one at your university, or it allows you to develop one, this is a place that you can find that kind of material, especially as related to academic integrity. Okay. Now, the literature on the graduate mental health students and also supervisees points to our training programs improving in many ways. But we also have some continued challenges. On the one hand, students report an increased focus on diversity issues, multicultural concerns. And so programs have really improved in that regard. On the other, they continue, especially traditionally marginalized students, continue to describe barriers to a sense of inclusion in our graduate programs and our training sites. Right? And as I alluded to a little bit earlier, um, students in their feedback, this is often anonymous or feedback to programs and also in surveys that have been done relatively recently, report experiencing microaggressions, inattention to impact of cultural difference and experience of traditionally marginalized patients, clients, and supervisees, and also the burdening of BIPOC community members being the ones to raise the issues of diversity, as opposed to it being the supervisor or the instructor. And at times, this is not uniform, but at times, either very isolated or perfunctory discussion of issues of difference in the context of our work of training. And so the literature actually suggests, I think, has some useful suggestions. And this is related. I want to go back to this for a moment. This is related to the concern about complaint issues and then how to handle them. And one of the ways of doing that is to infuse throughout curriculum, and this would be throughout our own coursework, relevant diversity content, not merely a single course or two courses and then you're done, as if we're not encountering all kinds of complexity across culture, gender diversity, religion, and that these are complex, highly sophisticated, and there are graduate programs focusing specifically on each area, right? So also, as has been pointed out by linguists and colleagues and others, our taking the lead in our syllabi and in discussions at the outset in raising difference as, in some ways, because of the current push to push that aside, to discuss and talk about the impact of wide range of diversity on all kinds of things related to the training of psychologists in graduate school and provision of services. That this is a crucial and central component across coursework in our assessment and reliability and validity of our evaluative instruments. In our teaching students about the use of empirically supported treatments that had not been researched as much, although the research now is emerging in work with diverse populations, about the cultural adaptation of specific kinds of interventions, just a whole range of things, and inviting and actively exploring and thinking about not only our own, but our student and supervisee identity and positionality in their work with diverse populations, which is really the norm rather than the exception nowadays. And respecting those differences as integral part of coursework. In my ethics and law class, as I began to learn more and receive really wonderful consultation and mentorship from colleagues about this, I found it easier and easier to infuse into a year-long class on law and ethics, not just one little piece or a couple of classes, but weaving it in throughout the semester and throughout the year, highly relevant in many different dimensions of legal instruction as well as in talking about ethics. One example that I'd like to give has to do with disability. And my colleague and co-author and friend Rhoda Olkin did a presentation relatively recently and was kind enough to give me permission to use some of this content, where she spoke about that for every graduate psychology student with a disability who registers with the Office of Accessibility, 2 have not. Right? She described many barriers, and she's done surveys and research for many years in this area, that many barriers exist regarding students self-identifying as a person with a disability. There are fears of stereotyping, well-documented skepticism among faculty and also administration regarding claims of disability. And interestingly enough, the actual diagnoses that students have often include ADHD, psychological diagnoses. Those are some of the primary areas. And it's somewhat paradoxical that in a very field where that's our expertise, we doubt that our students could experience those things. The Americans with Disabilities Act, as amended, protects students, but it also imposes a burden upon them. You know, from K or even before through 12, there are affirmative duties under the Individuals with Disabilities Education Act and the Rehab Act 504 for school districts to identify students with disabilities and then provide the necessary services for them to be able to benefit from a free public education. But once students get into graduate school or even college, those rules don't apply anymore. Now it's the ADA and some other standards, to be sure, but it's primarily for students with disabilities, the ADA. And the student has to come forth and say, I am a person with a disability and I need to have some accommodations in classwork. So including in our syllabi and also in our descriptions in our agreements with students who are supervisees about information about disability and accommodations is an important step. But this is not necessarily easy because we are not permitted to ask a student whether they're a person with a disability. Okay, so it really does rest on the shoulders of our students and supervisees to raise the issues and to seek accommodations. Now, I want to go off on a slight tangent here. What if they have not done so? What's the obligation of the faculty person or the supervisor, right? You are not obligated to provide any accommodations if the student has not requested them. And if they were to say, well, I have ADHD, which may be true, but I didn't want to talk about it and I needed something more after they got a less than favorable grade for a class, doesn't fly. You're not having to accommodate at that point. But from that point forward, in any educational experience you provide to that person, you would engage in doing reasonable accommodations, usually decided upon through the Office of Accessibility. Okay, so students have to tell us beforehand, but they're the ones upon whom this burden rests. Okay, and we do not ask. So it's a really good idea in our syllabi to say something like, that we invite students to talk about and to go to the Office of Accessibility if they're a person with a disability, and that accommodations, reasonable accommodations, are part of the curriculum, all right, part of the program. And even giving a bit of a vignette, about students who've had that experience. So you're not saying, I think you all are people with disabilities. You're saying, just to give you some examples, and you can make some up, some hypothetical student or intern or supervisee. And don't forget to put your own document in accessible format for those students with visual impairments or blind students, or if you're going to be speaking in class, things are getting a little bit different with the possibility of AI transcription and also translation. But if need be, then people with hearing disabilities or people who are deaf would be having an interpreter, right? And you can also provide community resources in addition to the university resources. This would be a great example of a vignette, okay? A bright student in a graduate seminar, and I borrowed this from Dr. Olkin, by the way, a bright student in a graduate seminar struggled with severe ADHD, making it difficult for her to attend to and recall lecture material. It impacted her grades on the first two quizzes. After registering with the Office of Accessibility and requesting a reasonable accommodation to involve a fidget object for her knitting and informing her instructor, her remaining quiz and examination scores were near perfect. Okay, It's not always that kind of success story, but it can really help. And it's a way of inviting that information. All right. Well, um, those are related primarily to uh, the syllabus that you create and my emphases here on those aspects in order to manage and reduce the likelihood of complaints and also give you a basis for articulating when there is a complaint what your evaluation was and why. Okay. But I have three remaining aspects of structuring coursework. And some of these can and apply to a placement as well to help reduce complaints and also help us weather complaints if they happen. Okay. There are a number of universities, and also there's been literature now for quite a while about having class or community agreements that are created collaboratively by faculty and a particular class, group, cohort, and they become an aspect of the syllabus. They become attached to the syllabus. You can have all of your pieces of the puzzle together and still have a community and class agreement that is part of that document, but also part of the structuring of your educational process. These are especially helpful in getting at issues of behavioral norms in a classroom. How are you going to have discussions? What constitutes respectful speech? Again, lateness and early leaving. What happens if there's disruptive behaviors such as texting? And many of my colleagues have very different approaches to this. Some say, look, it's not worth my getting into it. Others say, all of you got to turn off your phones and put them in your briefcase or in your carry, and no phones in class. Well, all of those are legit. But if the behavior is problematic and the person takes out their phone, then how are we going to deal with it as a group, right? And I think these can be especially effective in graduate classes to engage students and trainees and also increase the likelihood that there will be essentially kind of a values alignment between our students and us and the work that we're doing with them. Okay. Now, there are many models out there. I've just, in this initial slide, giving you a sample from Stanford University's Teaching Commons, and it delineates a number of different components of a norm and commitment. And granted, this is university-wide and often gets used in undergrad, but I found these to be remarkably helpful at engaging and aligning students with the program and also the particular seminar structure. So they talk about and encourage us to, at the beginning part of a class, that if we identify norms together, it helps with transparency, clarifies expectations. That's what my whole conversation is about today, and then following through on them. And also can help in both a sense and in real equity, fair, more balanced for all students. There is something about writing things down that does, especially if the students are agreeing to this and it then gets posted as an agreement or distributed, electronically. Long ago, I worked quite a bit with adolescents, and all of them were kiddos who were involved in the juvenile justice system. And they were definitely a wild bunch, and I enjoyed them tremendously and also saw lots of growth in those kids. But I had a supervisor in that context who, when youngsters entered our residential program, they had to sign a contract. And what the supervisor said, and I initially said, come on, these are anywhere from 14 to 17-year-olds. What do they know about signing a contract? And she said, it's true, they don't have any sense of the legal weight, but there's something about actually putting it in writing for these young folks. And I think also for us, having this be something that we take it down and we distribute it, it's in writing, that makes it an agreement with more gravity to it. It's not simply an edict by the program or by the instructor. And I actually saw that happen. It was quite of surprising to me. I didn't think it would be effective, frankly. I thought it was kind of like, but it was interesting to see. It helps students have a sense of agency and engagement, uh, allows them to be part of shaping the environment. It also can enhance a sense of being empathic and respectful about differences of perspective. And it distributes some of the responsibility around the classroom and the seminar, as well as giving a sense of unity in the class and a sense that we're in it together, right? A sense of community. These are some structures, ways of developing a process for developing a collaborative agreement with one's seminar, for example, in clinical and ethical issues, or one's class in teaching the Rorschach or the MMPI. Okay. Ask students for their experience of the best group discussions they've ever had in a classroom, and then their worst. And then see if they can share at least 3 aspects that made the characteristics of the particular class. And students will sometimes struggle, graduate as well as undergraduate, of course, but with what was it that made it different. But if you're patient, often they can come up with some really concrete kinds of aspects. And then ask them to identify the negative characteristics that made it, those bad experiences, not so great. Okay. And then use those to draft the ground rules and share them in writing. Okay. And periodically, and I'm not talking about the end of the semester here, I'm talking about periodically ask whether they seem to be working and are there adjustments necessary. So this goes back to our ethics code. We're allowed to adjust things. We just have to be forthright about it. Okay. Harvard's Derek Bach Center, which is their teaching and learning center, gives some examples of the kinds of agreements, and I've given you a link here if you're interested, based on what they talk about as an implementation of values. And just to give you a few samples, hold yourself and others accountable to high standards of excellence. One person speaks at a time. Be open to changing your perspective, Step up, step down, or, I like that step up, step down. You step forward, you step back. You give other people a chance, but also you listen in the classroom. And I really like some of the practices of, for example, don't just talk to talk. All of us have had the experience of the student who is very vocal and understandably really wants to impress, and the students who say nothing. Okay, these agreements really help to bring forth students who are not as active. We need to know them too, okay, in our seminars, in our supervision, right? At a group level, the values are everyone has a right to be heard. We have to be honest while being sensitive. So the idea of honesty should not be used as a weapon. It should be used as a support. So, assuming good intentions, for example, be respectful while being critical of ideas. No name calling, no labeling. Don't tear down, prop up. So, straightforward. Maybe you think, oh, this only applies to younger students. Not in my experience, and certainly not in my relatively recent experience. It's been a little bit of time now in grad school. So, the second of these 3 remaining aspects, in addition to structuring the syllabus, as I've mentioned, is create multiple avenues for getting feedback, not just giving it, getting feedback. We all do the end of the semester evaluations of us. Many of us both dread and value those end of the semester, what Dr. Taub's course or whatever it may be, right? But these are too late. They don't help us really change and do what I like to call, course changes in the middle, okay? And while many schools will have mid-semester feedback processes, which I really value, especially the anonymous ones, I think can be very helpful. Um, I think it's increasingly important to have an ongoing avenue for anonymous feedback that allows us to take seriously and into consideration what's happening during the semester. And most of us get the feel for a course or a small group, but we do not know what the very quiet student is thinking, even when we ask them and they say, oh, yeah, this is fine. We don't know. And even the student who's quite vocal may not be as forthcoming about criticism or being worried about upsetting you, because there's a lot at stake in classes, especially if it's a class where there's an expectation that they'll be active and they get credit for it, and it's about their oral presentation skills as well as questions and so forth. So it gives us an opportunity, and it also reduces the likelihood of formal complaints, these mid-course or early course corrections. And they're especially effective at forestalling complaints that we didn't give them feedback in the interim. We only gave them at the end of the semester their feedback about their performance as a supervisee, and they should have known beforehand. Okay. It allows us to do a genuine attempt at addressing concerns or distress, and the distress may not have a credible basis for it, but it allows us to hear it and do our best to have a conversation about why a specific evaluation was done, what you were thinking, and I think, at least with some students, will reduce the likelihood of a formal evaluation. The third aspect here is related to what are ongoing debates about: should you be flexible or should you be rigorous? I actually think that that's the wrong question. We can build flexibility into any structure that we develop. We can have options for showing mastery. And for many students, they may not be that good at doing a multiple choice test at the end of the semester. That's something that was my preferred way of measuring content knowledge. But they were remarkable at doing a presentation or a slideshow. Maybe they weren't so good at writing a paper, and that skill is necessary to improve, but they could, with a few different drafts, really improve. And I'm sure that many of you here have seen this happen as well, where I saw some students at the beginning of graduate school who had almost no writing skills. And by year 2 or 3, they were producing quite good work. They were really bright, but they didn't have the skill, right? So it's going to be repeating myself. The heavy lift here is that we have to abide by the structure that we put in place. So if we're going to be flexible, we have to make sure that we're fair in its application, that all students have the same opportunity. Be consistent in how you apply the exceptions to the rule. This is the hard part, in my view, because it's going to be related to specific concerns or issues that we have with a particular student or set of students. So to summarize, how do we try to reduce the likelihood of complaints? And this is about prevention. It is about, in my view, taking the ethical view of instructor supervisor power seriously, and using the syllabus or the description of a program as a structuring tool that has clarity, especially regarding grading, evaluation, timeliness, and also that allows us to attend to a diverse student body with very different learning styles. Use class agreements, these collaborative agreements. They have been shown to significantly impact adherence to a particular class value. And if there's a disagreement about it at the beginning, you get to hear that to begin with, rather than finding out at the end of class and having a complaint filed. Okay. And encourage and provide avenues for frequent feedback. This is, as one of my friends and colleagues who's been a teacher for many years likes to say, don't fight it, invite it. This is about getting feedback. Ask for it, okay? And to the extent that we can, build in flexibility in ways students can demonstrate mastery and skill and their competence, showing us that they can engage in the activities that a budding professional needs to learn. Now, there are some things that we're not going to be able to be flexible about. The student's going to have to be able to show us that they're competent in administering a WACE, and whether that's an observation by a supervisor or in your class, having ways that really going to be behaviorally grounded, there's not going to be a lot of leeway there. But there are other ways to evaluate mastery and other components of being, a competent evaluator, an evaluating psychologist or neuropsychologist. So I'm going to shift gears into supervision, but some of the same themes will emerge, as you'll no doubt be aware. And I'm going to start this one with a vignette. This is a vignette involving Dr. Super, who runs a clinic where she supervises interns. They're at a master's level, they're going for doctorates. Some are going just for masters, terminal masters, but most are going for their doctorates. Her preferred method of supervision is either video or audio. She loves doing live supervision, but she's not able to do the live supervision that often. And so even though she's tried to build it in, most supervisees, though they have initial nerves, nothing anybody here would ever remember, including me, but initial nerves about being videoed or recorded, audio recorded, or being supervised live. But after experience with her, she's a supportive, kind, but very clear supervisor. Most find it really valuable. One supervisee, however, Mr. Intern, is particularly anxious about being observed. And he says, because he started seeing a family, he says he'll bring in the video recording next time. He didn't get a chance to get consent from the family. But then, even though Dr. Super checked with him, it took 2 or 3 weeks, and he finally came in and rather sheepishly said, well, the family's refused to let me video. Well, Dr. Super says, okay, ask if these can be audio taped. He came back again in a session or two, supervisory session. He said, no. So she said, okay, well, we're going to have to settle for process notes. Those can be valuable in many ways, but they're not the same as me being able to see what you do or hear what you do. And he's working with a family where there's a co-parenting issue, okay? The parents, it's a stepmom and biological father, attended a recent session, and father got very angry with the stepmom because they had a conflict over limit setting with the biological father's son. And in the session, the father intimated physical threat to his spouse. And then the stepmother became kind of initially frozen and frightened, and then probably not much intentionally revealed that there had been some intermittent and somewhat serious intimate partner violence in this relationship in the past. Mr. Intern had been the behavioral liaison to an emergency room in a general hospital in his last placement. And in that state, there was a requirement for anybody working providing health care, and he was considered providing health care, to make a mandated report to law enforcement. He told the family, I'm going to have to make a report. The father became enraged, stormed out, threatened to sue, and the intern, without having talked to any supervisor, made the report. When Dr. Super found out about this in the next supervisory meeting, she was quite alarmed because in her state, there was no mandated report for doing outpatient behavioral health services. And sure enough, the intern got a lawsuit, a summons and complaint from the father's attorney, and shortly thereafter, so did Dr. Super, violation of confidentiality. The father also alleged that Mr. Intern misrepresented himself, and he hadn't known that Mr. Intern was under supervision until the complaint had been lodged. This also came as a surprise and dismayed Dr. Super because in their first training session, she gives all interns, she tells them to clearly inform clients at the beginning of services that they're being supervised and by whom. The father, it turns out, is also suing Dr. Super for negligent supervision. That's a direct liability claim. And to make matters even more distressing, Mr. Intern filed an internal complaint against Dr. Super, saying she hadn't adequately supervised him. Oh my, what a train wreck. Well, as regards supervision, very much like when we are a graduate faculty member, we have to have an agreement, a very specific and detailed agreement about the nature of this relationship, about the process. And also, we have to have an agreement that allows us to revisit it so we can engage in appropriate supervisory activities. And this is before the intern or postdoc or trainee actually provides care. And I'll come back to that, okay? And the steps that I'm going to talk about are an interweaving of our risk management team's input, literature about how to best work with having competency-based supervision, as well as APA guidelines. Okay, so it's a mixture of those. So supervisory structures are important in part because of the power that we really have and that is attributed to you and me, right? And with that power, as Spider-Man says, comes responsibility. So are we responsible for what our supervisees do wrong or fail to do? And the answer to that question is we very well can be. Not always, thankfully, but the very well can be has to do with, did we have a clear agreement with them about what they were supposed to do or not supposed to do? Okay, so ultimately, if it's ambiguous or we didn't have such an agreement, then the answer is going to be yes. As a primary supervisor, which I've been for many years for different students, I'm not doing that currently, I'm responsible, as this bullet point says, the third bullet point, for the welfare of all of the patients and clients being evaluated and treated by my supervisee. Essentially, they're my responsibility, okay? And though liability for harms caused by the supervisee may be shared with an agency or they may be sued directly, that kind of liability can be imposed on me and you, those of you who are here as supervision. Now, they can be imposed in two different ways. The first, which is the lawsuit that you're the supervisor and you're responsible for whatever Mr. Intern did, is called vicarious liability, respondeat superior, right? That is, let the employer or supervisor answer. It's a Latin for it. The second is direct liability, and in this vignette, the supervisor was sued in both capacities, both directly because the claim was of negligent supervision and for their vicarious liability of the harm done by their supervisee. Okay, so it's important to keep in mind that any patient or client being seen by your supervisee is your patient or client. I'm going to say that again in a different way. Your supervisee, even a postdoc who's unlicensed, has no patients. They're yours and mine. And as a result, we are responsible for the care they get. So we are in this position as supervisors as having two sets of responsibilities. The first, as the APA guidelines that were put out last year, a really helpful document and resource, that we are responsible for the safety and welfare of clients, that they're getting appropriate treatment. And we are responsible for being gatekeepers and evaluators of our supervisees. And the notion here is that our competency in both sets of roles is required, okay? And competencies are not the same, as you know. It's gotten more and more well articulated that merely because one is a good clinician does not mean that a good supervisor they will make, okay? It often overlaps, but not always. They have different skill sets, right? So we get pulled in both directions, and our guidelines can be very helpful. But we have to also be very attentive to not only our ethical standards and guidelines, but also the laws and regulations in your own state. Now, in some states, just New York as an example on the East Coast, there are guidelines. They're not enforceable. But I just want to read you the first line in these guidelines that the New York State Board of Psychology puts out. The supervisor is ultimately responsible for quality control and can be held accountable for the professional services being provided by the person being supervised. Right? Almost exactly the same idea that I've been talking about in terms of respondeat superior and vicarious liability. Now, interestingly enough, other states, like California, the whole other coast, actually requires a supervisory agreement as well as a verification of hours and experience. Now, while their agreement is a really good starting place, it doesn't necessarily have all the things that we would recommend as risk managers, right? So, as I'm echoing what I was talking about vis-a-vis being even more effective, I'm sure many of you are highly effective and skilled professors, but even more effective. The supervisory role is collaborative in nature, and it's the hallmark of what allows us both to be good professors and supervisors and clinicians. Strong alliances, good interpersonal skills. I think many of you are aware that as the research on what makes some clinicians more effective than others, even when they may have a good level of technical competence, is whether they have strong interpersonal skills. It's not surprising, right? That makes good sense. And the goals in our supervision is to create a respectful, trusting, well-bounded, and safe enough relationship. However, these relationships are not going to be purely safe. And definitely, it is important to clarify one's evaluative role. Now, I know very few people here, and I'm going to stop at the end of this slide and give you all a bit of a break, but very few people here I would be worried about being punitive, dismissive, or using judgmental language with supervisees. But we get calls from supervisees, from supervisors in programs where they're struggling with a colleague and who has become punitive. That kind of approach, as opposed to a respectful and trusting one, is just going to result in the supervisee limiting what they share. And so starting with a strength-based approach is a very useful way to consider this, okay? And also giving our supervisees, just like our students who we teach, multiple opportunities to give us feedback. Don't fight it, invite it, okay? Because it's going to help us balance both the evaluative role and also the role of supporting and of providing and being careful about the care that our student or our supervisee is giving. All right, everyone, I'm going to start up again and move on to talking a little bit about how these structures can be put in place, and especially what the content would be. Okay. And as most of you are well aware, practicum sites often have agreements between the program or the institution and the placement site. Some are quite detailed, some are relatively unstructured. And APA and APPIC have criteria for structuring internships and placements, right? You may also have, depending on the state, some fairly specific regulations regarding accrual of pre and postdoctoral hours. That's fairly common. But in all contexts, um, uh, a detailed, explicit agreement between supervisor and supervisee, we highly recommend. Okay. In the APA guidelines, the internship guidelines, it says supervisors seek to specify responsibilities and expectations of both parties in the supervisory relationship. Now, the elements that I'm going to talk about, again, are intended to put a structure in place that allows this relationship to flourish. It's at least perhaps an inept metaphor, but we're trying to have fertile ground here for our supervisees to grow. And that fertile ground requires some containment and nourishment as well as structure. It's not simply water them and they'll grow, some perhaps, but overall, generally not. And these agreements are an essential way to structure in that regard, but also an essential way to reduce the likelihood that there'll be inappropriate expectations by our supervisee and also resulting complaints, or that if there are complaints that are valid, they'll be easier to sort out, right? So one of the ways that I think about having a supervisory agreement is that it is a kind of informed consent. It's also could be considered, a contract. And many, many moons ago, back in the Jurassic period, when I was in my first year of law school, I had a law professor, Professor Della Penna, I will never forget him, who liked to say that we have contracts because things don't go very well sometimes. And so contracts are documents to anticipate things going wrong. And that's stuck with me all these years. That doesn't mean we're going to have this highly legalese kind of agreement, but that we are using it to anticipate potential issues, as well as setting those expectations that I alluded to just a few moments ago. And so it's not only about the licensing paperwork, which of course is important, signing off on hours. It is an agreement, it is a collaborative approach to the work of being a supervisor and a supervisee, okay? Responsibilities get articulated, as do the expectations between the two of you, or between a group of supervisees and between you as the supervisor. There are specific standards. New Mexico, just to go to the Southwest for a moment, in the New Mexico Administrative Code, 622217, specifies a requirement for a supervisory plan, right? And that's just what we have in mind, okay? Now, to go with more of a theme of informed consent, rather than just doing this as a contract, but informed consent, I think of agreements with supervisees as a two-level informed consent. The first level is between the supervisor and the supervisee. And when there are complaints or difficulties with students who've not done well or have perhaps even broken rules, but the agency or placement is struggling to be able to help them improve, or ultimately may need to release them from their placement, it's this kind of agreement that's usually absent, at least with regard to many of the elements I'm going to talk about shortly. But the second level is the supervisee client. And in one respect, this is really about the supervisee facing the client who's really their supervisors. So it's communicating to the client about this professional relationship and who's ultimately responsible. But it also structures that client-supervisee relationship. It is essentially building the frame for what's going to happen. So there are two sets of processes here and two sets of informed consent. So to start with level one, timing is everything, okay? And make sure, if at all possible, and you may have some agreement like this, or you may not have anything, putting something in place before someone like Mr. Intern gets into a session and actually starts hearing about something like intimate partner violence between a couple. Okay. So timing, as is often said, is crucial here before they begin. And in addition to having this early, have it focused on what are our respective roles. I'm your trainer. I am somebody who's to support your success, to support you gaining the skills you need to do this work well. And I look forward to that. I'm also a gatekeeper. So while it doesn't happen often, thank goodness, if there's an issue that arises, it's my job to point them out, to help you remediate them. Okay. So that kind of supervisee supervisor role, and then really articulating what each of those means. Okay. And for example, how is it going to happen? We're going to do live in-session supervision like Dr. Super likes to do, but really can't that often. Is it going to be a remote supervisory session? Does the state law allow that? Right? There are lots of different components to this. And are these going to be in a group? Are they going to be individual? Usually it's going to be a mix, right? The criteria, here we go again, just like with the syllabus, the criteria to successfully complete the practicum, the pre-doc internship, the post-doc internship should be articulated as carefully as possible, okay? And again, anchored as behaviorally as possible. So this is not radically different than what I was talking about in the syllabus, but it applies to a different kind of relationship, and we don't usually have, except for perhaps the didactic part of our training programs, we usually don't have a syllabus for the experience that the person's going to get, right? It's also very important to set the expectation that the supervisee is going to follow the ethics code and federal and state laws and any regulations. So one experience I had was a supervisee coming from a different state, and they didn't have the same requirements for child abuse reporting as my state did. Well, the obligation, if that student, that supervisee, it was in a clinical placement, didn't make a report when it was required, not only is that my responsibility, it's my fault because I didn't train them in the difference. Fortunately, we do a fair amount of training about that in that program, so it didn't turn out to be a problem. But the supervisee raised it saying, well, that's not what you're supposed to report. And then we got into this conversation about, well, actually, it's true in X state, but it's not true here. Different, right? It's also very important, and this part is delicate because we don't want to start out by saying, so here's where we're going to kick you out, right? That's not what we want to do. But it is very important to talk about the standards of performance and behavior, and that if there are problems, the structure and method for ameliorating below expectation performance, okay? And then that it's rare, but it's also possible in any placement that a person may not make it through, but that's not the purpose. And it's not like I got in law school, my first day of law school, look to the right of you, look to the left of you. Half the people in this room are going to be gone. Well, they were lying, by the way, but still, it's completely the opposite of that. But the importance of letting the supervisee know in this relationship, your evaluative role, and that there's a process for it, and that it's about supporting success in performance and completion, but the obligation to make sure clients and patients are safe, okay? And then if there is a problem, the student or supervisee disagrees or feels they're being treated unfairly, that there is a process for appeal in your program. Let's suppose you're doing a postdoc and it's just you and a couple of other clinicians in a private practice small group, and you've now hired an associate who is trying to finish their hours towards licensure. Would you need this? Yes. Among other things, the small practices where you've got an intern or a postdoc, we hear and I hear, fortunately not every day, but routinely, at least a couple, 3 times a month in the calls that I do, issues that have arisen with a supervisee who's in a postdoc and it's a small practice. So having this kind of how do we bring a third person in to appeal or review the decision that's being made, right? Can be very helpful. It helps to assure that there's balance and it's not going to be biased. It's not a guarantee, and process is not the only component to fairness, but it's important, right? Also, it's my obligation and yours as a supervisor to train the supervisees in the conventions and policies that our organization uses. Okay, so whether it's a small practice or a large hospital setting, what intake forms are you supposed to use? When do you keep your documentation? What's the expectation about how soon you complete it? Okay, and what kind of preparation are you supposed to do, supervisees, prior to your supervisory meetings? Am I going to ask you to bring that video recording that you did, or providing notes? If we're going to be meeting about a particular issue, and I know you've asked about it, have you done the readings? And so very clear articulation of preparation, and that, of course, clients and patients are going to be notified that this person is not licensed, right? And not only are they not licensed, but what credentials they do have. You know, I'm not insensitive to that early in training, one is in some respects scrambling to establish credibility with clients or patients. Nonetheless, it is so very important to be forthcoming about who this practicum student or intern or postdoc is. They are not a licensed person. They're under supervision. They have some training, right? So we don't have to downplay that, but we do have to be clear that it's not at the doctoral licensure level, or if it's a master's license, the licensed level of independent practice for a master's level licensed person, right? And it must be in this agreement that the supervisee has to do that second level informed consent and bring that document back to show to the supervisor, whether electronically or otherwise. One of the other interesting components of supervision is that it is very important that the supervisee know that they're going to only practice within the scope of the supervisor's competence. So just as an example, if I have received just cursory training in EMDR, and I have a supervisee who has some training and some skills, if I do not have competence in that area, it's only a cursory knowledge, then they can't use those EMDR skills unless we find either a delegated or secondary supervisor who is competent to do that kind of supervision. So whether it's experimental or just a different skill set than I have or you have, the supervisee cannot do those skills or engage in activities that are beyond your competency. Because remember, this is your client, right? And you're responsible for their welfare, as am I. Okay. Very important to go over the financial policies that the agency has and that your organization has. In most states, New Mexico is an interesting exception to this, but in most states, supervisees are not supposed to be paying for rent or supervision. New Mexico does allow that. And I think my risk management colleagues would agree with me about this, I generally advise have these folks as employees, don't have them pay you, because it brings the impression of a conflict of interest. I'm paying my boss, so I get to tell them what to do. And granted, that may not happen that often, but it's a clearer kind of relationship and power dynamic to have them be directly employed and that they don't pay you for anything, you pay them. Or if they're volunteering, it's very clear this is volunteer and they're going unpaid, okay? They should not be, as a non-independent practitioner, not licensed, accepting direct payment. It should be payment to you as the private practitioner or the clinic or the hospital, okay? And this does vary to some degree by state, but also this is a risk management issue. Even if the state allows payment to the supervisee, be cautious. because of the appearances of a conflict of interest or an independence of practice that could suggest that the person's not really being supervised, especially if the rest of the information that we suggest is not in the agreement, right? You notice that I circled this one. Have a very specific understanding in writing with your supervisee that what they talk to you about, their client or patient or their struggles, you're not going to disclose to everyone, but it's not truly confidential. You can and are required to use what they do and say with you in supervision, group or individual, to evaluate them. So don't promise confidentiality. It's also very likely that the privilege of psychotherapist patient privilege in most states extends to the direct primary supervisor, but that doesn't necessarily include the evaluation of the supervisee. So that's an important part of the agreement and conversation to have. Regarding risky situations, like Mr. Intern encountered, okay, he had a parent who disclosed some pretty severe domestic violence and an implied threat in a session. Not all that common, but it does happen. Our job is to train the supervisee in the steps to take in this jurisdiction, in this hospital, and also to set up a structure beforehand that they will notify you or the supervisor who is currently on duty and available about everything ranging from a subpoena to abuse reporting, and this varies by jurisdiction. Some jurisdictions may require IPV reporting, others may not. That the supervisee needs to bring to the supervisor issues of imminent separation and divorce, statements like, I have just recovered a memory, if there are any boundary crossings or violations, right? And of course, threats to self or others. And if the supervisee is considering engaging in any activities that are experimental or new. And so we're asking them to check with us beforehand, right? Now, it's also, particularly in the shadow of COVID, very important to document and to clarify where is your supervisee going to be providing these services, right? If they're going to be doing remote care, must they do it from your site? If you're in agreement, and there's no rule that says you cannot do this, but if you agree they can do this from their home office, how private is that home office? Are there other people there? Okay. Clearly define the conditions for the delivery of that service. One scenario that has repeated itself in different parts of the country, especially during the height of COVID, was the supervisee doing their work from home, but they live with other people. For example, roommates, and they don't have a very private place to do the services from. Well, that's just not, it's not permissible. It is a violation of the privacy rights of the client and patient. So be very careful about, no, you can't do this in a public setting. I know it should go without saying, but don't not say it, a double negative, right? Also, be sure that your supervisee is sharing with you routinely their log of hours, because you may not need to sign off except once or a couple of times, particularly if they're at internship level, pre-doc, or if they're a postdoc. But if they're accumulating various hours that your state may require, a very painful lesson for a colleague of mine happened a few years back when their supervisee, their private practice supervisee, was keeping a tally on their computer of the hours and not sharing it because it wasn't required, and didn't have their supervisor sign them. But they were unfortunately a victim of a very large fire in that community that destroyed their apartment building, and their computer. And they didn't have anything but a hard drive backup, and that was destroyed too. And in that case, when the board was informed and asked if they could make those hours up, the board said, no, you have to prove to us that you did them. These were never signed off. You have to start from scratch. So get copies of those logs from your supervisee, or at least make sure that they have a copy off-site. So if something bad happens, they're not just plain old out of luck. Okay. And note that the supervisee is expected to either record or be observed in doing their in order to allow for supervision. And in the APA internship accreditation standards, they require, these are almost 10 years old now, but they require direct observation. And as you can see in this fly-in, a training site that does not permit live observation audio or video recording by policy is not a sufficiently unique circumstance to circumvent this requirement. So in any kind of APA-approved program, we must record. If it's APIC or private, if at all possible, please do that. You want to see the work that the client, that the supervisee is doing with this particular client. Okay. And again, and I say these, and I'm going to repeat a few things. Give an open method for the supervisee to routinely give feedback about the supervisory sessions, program structure, especially, it's going to be important to do formally, but informally. So if you have, a group of 5 interns in your program, let them give you anonymous feedback. You probably know who it is, and they may be a little reticent, but encourage it. And have that be routine, and ask them for it, not just once in a semester or once in a year. Okay. Now, Ellis, about 9 years ago, published a very interesting article about the importance of informing supervisees about their rights. And I've given you the citation in your references, so you have that available to you. But just to give you a sampling of some of the things that Ellis suggests, it's the right to receive supervision, to be informed of the supervisor's theoretical approach, to be treated with respect, to be informed of supervisory goals and objectives, resolve conflict, be treated ethically, and so on. So I would encourage you to take a look at that article. It's a great resource for listing the rights that our supervisees have. All right. Now, part of the agreement, those are the core components that I would encourage to have in an agreement. Part of the agreement is going to be what your and my responsibility is. What am I expected to do? Now, I'm emphasizing this with my movable language here, but please, absolutely as much as possible, do not cancel, do not put supervision secondary to the work you're doing, because you and I have made a commitment for our students' training and hours. Complete those sessions, okay? And we have to be willing to provide as much supervision as a particular supervisee needs, even if the legal requirement is, say, 1 hour of individual and 3 hours max of group, and for a 40-hour week, they may need more. And so we have to be willing to make room for more if that person needs more, okay? One of the other components is that we regularly review their records, their documentation, as well as notes and recordings. And this takes extra work. We often don't have time. We can overlap by viewing video or listening to recordings with them in their sessions. In their supervisory sessions, but it's a very wise idea to try to sample more. All of us can get embarrassed by not doing as well as we think our colleagues or our supervisor might expect. All of us may be somewhat selective, either consciously or unconsciously, about what we present in a session. And most all of us have had the experience of, what is the word being used now? Curating what we present. As supervisors, we want the least curated information we can possibly get. Also, make sure you agree to and document your supervisory sessions. Special attention to higher risk circumstances. A threat of domestic violence or a threat of suicide. Document having spent time, what you advised and suggested. Those documents don't have to be pages and pages long, but just like our work with clients, these documents become essential. If there's a question down the road, as there was with the internal complaint, as well as the lawsuit for negligent supervision against Dr. Super, these documents can be very powerful, okay? The other things that the supervisor is expected to do include having a very clear criteria for evaluation, and please do not use the term with your supervisees impairment of your supervisee. Fine with clients and patients, but supervisee impairment implies that the person is a person with a disability and that we therefore have to do a reasonable accommodation. And if the supervisee has not said anything about having an impairment, first, we may be setting ourselves up to be obligated to do a reasonable accommodation that may not even be necessary. And second, we're not focusing on the direct issues regarding what this particular supervisee's performance is. So I would encourage you to keep in mind any documentation language about problems with the supervisee being related to performance-anchored language, not impairment-anchored language, with the exception of if the supervisee discloses a disability and requests reasonable accommodations, and those get negotiated, and then you're providing them to address the student's request for a reasonable accommodation, and you document those, okay? I know I'm repeating myself, but frequent formative and summative feedback, okay? And having a rubric is not as easy in doing actual supervision, but it's quite clear as the guidelines for supervision say, in D2, providing formative and summative evaluation of supervisees' progress toward meeting expectations for each level of education, and modeling alone is insufficient. Supervisees need clear criteria to judge the extent to which they are demonstrating developmentally appropriate professionalism and feedback about meeting criteria. So I know I'm repeating myself about that, but that's one of the key components to these agreements and a key component to avoiding complaints that could have a basis, all right? And of course, formal written feedback is important, but you can do even the informal in writing. This is where the balance between having it be, having a conversation with your supervisee about a particular intervention that they used, or that they appeared to miss something in a session. We all miss something in a session, where you point it out and you document in your supervisory notes. It doesn't have to be, you talk about it and you document it. And now you've got a trail that describes the particular issue. It's good to remember and document the successes. And I think leading with those is one of the things that can really encourage the supervisee to stay on track. Getting heavily weighted towards the problems they're having can be quite discouraging. That's not to say we shouldn't. In fact, we should be talking about those. But as much as the student's performance allows, pointing out what they're doing well, okay? That's level one. Right? Now, I know that's a lot. And I've had colleagues of mine, when I've described this kind of model, say, how the heck, Dan, am I supposed to do all that? Well, start with the basics, all right? And I'll get near the end of my presentation this afternoon, I'll talk to you about what I think the core is, but what I'd really like to see is all of this, but at least have some of the basics around expectations and roles and feedback, and if there's a problem, what's going to happen, how you're going to address it, and then build it out from there, okay? So I know it can appear to be a lot. What I find to be really helpful is, much like the informed consents that we develop For our patients and clients, once you have it in place, it becomes rather routine. It's critically important to review it orally with your supervisee and talk about questions and talk about expectations, but it gets to be much more part of the training experience and process and less of a, oh, this is what that Taub guy said we should be doing, and it's just a pain in the neck. Well, it could be, but I think it really serves, again, that function of structuring a relationship so it can thrive rather than either letting it just happen and people, quote, succeed and fail as they may, including the supervisor, or not having enough specificity to be able to appropriately avoid complaints happening and appropriately deal with them when they do. Now, level 2 is the supervisee patient client. And I'm not going to go through detail on this one because the level 2 supervisee client informed consent has many elements that are just identical to the standard informed consent. I will highlight, however, that the supervisee's education, training, and experience should be in that form, right? And, right, so this is level 2. And, of course, mirroring the level 1, how the client or patient pays. If they're using private pay or it's a low-fee clinic, they have a check or they give a credit card. Who has permission to charge that? It's typically not going to be the supervisee, okay? And they're not usually going to be paid directly. Usual rights of clients, but also emergency access, not only to the clinician, but if need be, to supervising clinicians. So that's going to be a bit different too, okay? It is especially important to include a statement along with the education and training of the supervisee that they are not licensed and that they are being supervised by a licensed professional, a licensed psychologist. Include your name, your license number, the type of license you have. You know, and I know this is true in a number of states, but there are some folks with doctorates who may be marriage and family therapists, or they may be DSWs and get a license as an LCSW or an LICSW. Make sure you have that in this level 2 informed consent form. And then contact information, right? Well, this echoes what I was raising before, that supervisees may feel sometimes undone by this. Like, well, how am I supposed to be responsible and seen as a treating clinician if your information is there, Dr. Dan? And not only is this information crucial in the informed consent form, but there are a lot of other ways to establish credibility. Good listening skills, good reflection, appropriate use of, for example, DBT interventions. Talking about that the person's in their 3rd year of their graduate program and has been at other placements, or is in their 4th or 5th year and are in an internship and has been in 3 different placements under supervision, and that they've been trained in various types of approaches. So there are ways to counteract. Could it be, and this is something over the years I've heard on multiple occasions, that a patient or client says, well, I don't want to work with you. You're not like a real doctor. Well, that's their choice. If our training clinic really offers a majority of services through our interns or pre-doc interns, then we would refer out. But it's a choice that the client or patient should get to make, and also crucial information to include in this second level, but kind of normative informed consent form. And then if the supervisee's client has questions or concerns, they should talk to their therapist, the direct provider of their service, but also here's how to reach the supervisor, okay? So how does this all relate to my original vignette that I gave you in talking about this situation, right? What could have been done differently? Well, first, I want to say to you, I don't think Dr. Super did a bad job, was a poor supervisor. I do think that there were a number of things they might have been able to do different. So let's suppose that instead of what happened, Dr. Super and Mr. Intern had a level one agreement or level one informed consent. And Mr. Intern and the parents together had gone through orally, and the parents signed this level two informed consent form. And there was a signature by both parents. Mr. Intern, in keeping with his training, consulted with Dr. Super prior to making a report about the intimate partner violence, right? Well, I think what would have happened to the lawsuits, not necessarily the ire of the father, he could have sued, but I think those lawsuits would have gone bye-bye. I think the chances of their being dismissed on summary judgment or even a licensing board complaint, like, once the documentation was provided, either on advice of counsel for Dr. Super and or Mr. Intern. So definitely consult with an attorney before disclosing that material to your licensing board. But once it was seen, probably there would be a much better chance of avoiding, first of all, avoiding the scenario to begin with. Mr. Intern would have gone, oh, you mean I don't report it in this situation? It could have preserved the therapeutic relationship. That's crucial, right? But even if a mistake were made, much better chance at having the scenario turn out well. Patients and clients, Mr. Intern, and importantly, Dr. Super. Okay. Now, a few other suggestions about how to set up relationships with supervisees to reduce the likelihood of complaints. None of this is, a guarantee, but it's about, putting the odds more in your favor. If at all possible, meet the supervisee before you agree to be their supervisor. I know that's not possible in all settings, but there were some settings where I had no choice as a supervisor. I might have been part of a team who would screen people, and then the choice was left up to the director. And I might be supervising somebody who I didn't feel that comfortable with in the interview. But if it is possible, talk to them, just see what kind of relationship seems to develop. If there's something that turns out to be a caution flag for you, then maybe this isn't the person for you. Then maybe you talk to a colleague in your department who seems really comfortable with this supervisee and you trade, okay? Again, it's not always possible, but it's a good suggestion, good idea if you can. I know I've said this before, but please do not cancel those supervision sessions, group or individual, unless it's absolutely necessary. Keep them as you would a client session. It is one of the most frequent complaints by supervisees where they say they're getting inadequate supervision, and they say the supervision has been canceled numerous times. And when a liaison or a reviewing body or individual interviews the supervisors, the supervisor feels understandably somewhat defensive. And so, I've got all these clients and there were emergencies. Well, that may be, but the obligation is to provide that supervision. Now, if your institution has a structure around evaluation, great, use it and follow it carefully. But that doesn't limit you from asking more rather than getting less, okay? And include how the supervisee is going to be involved in giving feedback. And please, and this is another one of those red flags, if you see a problem emerging, it's time to talk about it. Do not wait. That's the other thing that gives rise to problems. It's not that the supervisor was wrong about an issue, but they may say, I wanted to wait and see. It wasn't that big, or my supervisee had some problems with keeping their records. I had problems, so I didn't want to put pressure because I knew they were anxious. You can be supportive, but you got to give them the feedback and document that you've done so if there's a problem. You don't want to have surprises at the end of the semester or the end of the year that the person is not going to be passed because they've done such a poor job on their documentation, right? So early feedback, early and often. Now, although this may seem to go without saying, some of the other calls that we get have to do with supervisor-supervisee multiple relationships. And as a general rule, please avoid these. They're just train wrecks, okay? Of course, they can't be your past therapy client. They can't be your current or past lover or spouse. And they shouldn't be a business partner or a current therapy client. Those are all clearly over the line vis-a-vis our ethics code. Okay, they're clearly multiple relationships where one's objectivity, competence, or effectiveness could be impaired, or the person could experience and have a credible complaint about being exploited or harmed otherwise. Make sure you're thinking about these beforehand. And just to give you an example, suppose you've got a client from way back, 10 years, 8 years, who did really well in treatment. And they've since gone on and completed a degree towards licensure. And they benefited so much from you that they've come to you and said, you changed my life. You saved my life. You're the one I want to learn from. It may be tempting. I've talked to clinicians who have said yes to this. But here's the rub. Suppose the arrangement does not work out as planned. There are glaring problems with competency. You discuss the need for remediation, but this particular client is very sensitive to criticism and says you're biased because of what you know about their personal history or because of what they disclose to you in the therapy that they believe you're now using to judge them as a clinician. And they make a board complaint or they threaten a suit for unfair treatment. I wish you all the good luck in being able to defend that situation, but this is trouble. And this is likelihood of liability and likelihood of a founded board complaint. So please be really careful with those, okay? Now, also be very thoughtful about boundary crossings, When is it okay to touch a supervisee? It is not as sensitive a circumstance as touch between client and patient, and there aren't any hard and fast rules about that. You're not doing something illegal or per se unethical, but with touch. But with supervisees, it is very important to consider how might this person respond to a hug? How might the other supervisees in our cohort respond? What if I just gave a hug to one person but not others? What are the circumstances? It's one thing if my supervisee comes in tears because they lost their partner to cancer and we're all sitting around and I put my arm around them. Okay. But if the circumstances are not clear like that, it becomes more fraught, right? So consider how it affects the cohort. If they're the only person, we still have to consider what is their experience of this touch. Do they see it as intrusive, seductive, reassuring, comforting, a mixture? Be cautious. Doesn't mean you can't, but be cautious. Are we consistent if we have 2 supervisees or 3? And here, this has to do in part with how are we approaching the person, but also there may be differences in their comfort level. So we have to check in about it, and it requires a thoughtful conversation at least, okay? Please, and these are calls we've gotten, so I'm not making this up, I promise. Please don't have your supervisee ask them to do, babysitting, picking up your laundry at the laundromat, cutting your lawn, even if they say, that would make me so happy to do that. And they may actually genuinely be quite happy. The power differentials in the relationship can be incredibly potent. And if something goes wrong, heaven forbid, what happens if the child gets injured on the supervisee's watch? How does a loving parent who's totally upset and angry because the supervisee maybe invited a friend over and they had a couple of drinks while they were looking after your child and the child got hurt, how do you differentiate that from the professional training process. And while I might say, and you might say, well, it's related, it is a separate interaction in a different role, and it becomes very difficult to differentiate. And if that supervisee then claims that this was a multiple relationship, that complaint can have and will have legs. Now, I want to make a distinction here, and one that many of you are familiar with. It was a classical distinction. Uh, uh, Tom Goodheil and Glenn Gabbard wrote an article, really, I think, a groundbreaking article in 1993, so over 30 years ago, where they acknowledged that in our real work with clients and patients and working with people, trainees, that there's flexibility that's required. And they kind of introduce some interesting language to help us consider flexibility and differentiate flexibility from exploitation. Okay. And so their notion was that there's a difference between a boundary crossing and a boundary violation. Boundary crossings are departures from usual practice. They're non-exploitative. They're not likely to be harmful. They may even sometimes be helpful. They're not in themselves unethical. Tom Goodheil later kind of framed boundary crossings as possible red flags, but not inherently good or bad. I actually have a bit of a different approach. He did that in an article on malpractice and what he calls malpractice and what was the term? A great term, malpractice and boundaries. And there was another term for it. It was a later article. I think I might have put it in your references as well. But he talks about it in terms of the potential for it being used against us. I don't see it so much as a red flag as I see it as a caution flag. Like, be careful, okay? And so that's the key. You know, is it always going to be against the rules to hug or have physical contact with a supervisee? No, it isn't. But they differentiate that from a boundary violation. While boundary crossings are inherently, they're not neutral. They are going to have some effect, as Ken Pope points out. Boundary violations are harmful or exploitative, and they will be usually considered an abuse of power, often for the needs of the supervisor, not the supervisee. And they are considered unethical, but part of the challenge in these is that it's not so easy to determine ahead of time what will end up being, with hindsight, considered a boundary violation versus a boundary crossing, okay? And licensing boards and judges and juries tend to have a very kind of conservative approach. If something is alleged that is bad that has happened and they're looking at other kinds of boundary crossings, they may see, you know, excessive self-disclosure or social contact or a financial favor as evidence that this professional didn't have good boundaries. So be careful, okay? But do not eliminate it. I think you can be very warm, very supportive without having to do a whole lot of boundary crossing. And if it's your style, just be very careful and thoughtful with your supervisees. Talk about it beforehand, okay? So the syllabi and the contracts that I've talked about this afternoon set the stage for preventing and, if need be, reducing conflicts and complaints. Not a single one of us is ever going to be perfect. We're not going to always know what to do. We will make mistakes, and we may intentionally or otherwise not act in keeping with a particular standard or guideline, or sometimes even a legal requirement. So if a conflict emerges or complaints, these agreements can help provide clarity about how we respond, and they give us a roadmap. They help us have, as well as our supervisees and students, have a roadmap for what do we do next? What if, right? If you do have a situation that arises that isn't sufficiently serious to warrant a formal process, a student, for example, engages in falsifying documents, for financial documents or a record or their application, that's going to have to be formal, okay, under most circumstances. but building in informal avenues for conversations and for addressing difficulties. I can't emphasize it enough, okay? It is one of those preventive techniques that truly bears wonderful fruit, to loosely stay with my earlier, fertilize idea. Let me give you a couple of examples of problems that have arisen in supervision, okay? One of them, Vignette B, is actually a case that was decided about 14 years ago called Ward versus Polite. In this case, a practicum student maintained a firmly held religious belief throughout her coursework, and she was an outstanding academic student in a master's program, that she cannot affirm relationship choices of LGBTQA plus clients, among others. In her required practicum, she got assigned a gay client. She asked her supervisor to either transfer the client or allow her to work with the client with the acknowledgement that if she was asked to affirm his relationship choices, as she put it, she could transfer the case. The supervisors at the placement transferred the client, but the program found that the student violated, in that case, the American Counseling Association's ethics code, and she was dismissed from the program. She sued in federal court and won at the appellate level, resulting in a settlement in the lower court. The second of these two vignettes, the first having been Dr. Super and Mr. Intern, a transgender predoctoral intern asked their primary supervisor to address them as they, them. Okay. The supervisor said they'd struggle with patients and clients and should choose the pronoun consistent with their appearance as female. The distressed intern sought to have the training director mediate a conversation with their primary supervisor. The director suggested that the intern attempt to do that privately on their own, in keeping with our APA code for informal kinds of conversations. The intern then made a formal complaint to the organization's HR officer, and an investigation was begun. Well, what could have been done differently in these circumstances, in keeping with what I've been suggesting so far? With all due respect for hindsight bias, easy to correct things once they've gone wrong. Well, the supervisors and supervisees in both situations are required to act in accord with their ethics code, okay? And when you respond to a trainee or intern, the supervisors would have benefited greatly in slowing down, slow and easy, and consulting with knowledgeable and trusted colleagues. Going over the programmatic but also supervisory agreements and compliance processes are essential before going further. And what would be really important in these circumstances both is, were the policies and rules applied across different students in a fair manner? Okay. So let me return to Ward versus Polite for a moment. Interestingly, the court clearly affirmed the university's, this is a Michigan case, but tried in federal court, freedom to adopt non-discrimination policies, okay, and also to adopt ethics codes of their professions. So the court did not dispute the power of organizations and professors to do that. But what it did say was that the school did not have clear standards about when they would permit referrals and when they would not. So because there was a lack of an agreement and a programmatic policy about, we will allow transfer of cases, for example, if the clinician has experienced trauma and is being triggered by that particular patient, but we do not allow transfers on the basis of a person's status or identity. They didn't have that kind of policy. So they didn't clearly articulate the structure in place. It's a great example of the absence of a particular piece of structure. Now, I understand we can't cover everything, but it's a good example. Okay. Further, in the disciplinary process, and this is really a no-no, one of the faculty questioned Julia Ward's, that was the plaintiff's, religious beliefs. That is particularly since it was a state school, so, fundamental rights of religion are upheld in anything that's run by a state or federal government, at least theoretically, at least in our Constitution. The focus would not be on her beliefs. The focus would be our ethics code says this, and this is what we must do, and you did not do that. So it raised the possibility that the decision was not made on the basis of her choice, but on the basis of her religious belief, at least according to the appellate court. So they overturned what was called initially a summary judgment by the lower district court and sent it back to the district court to decide, had the school basically made a decision to kick this person out and said it was because of the ethical standards, when it was really a pretext for discrimination regarding their religious beliefs. Now, we will never know because the parties settled before there was a decision. But Steve Benke, soon after this case, wrote a very elucidating article where he spoke to the importance in our programs and in our supervision that we can definitely adopt and be clear that we're adopting the ethics code. I would add to his wisdom, training programs have to apply the standards and say it applies to everybody. There's no exception here to your being able to get a transfer because of identity of the patient or client. His second idea was training programs may prohibit students from imposing their values on clients. The appellate court in Ward versus Polite explicitly said that. Okay, so we're allowed to do that. But anytime there's a discussion about any religion or belief systems of the patient, the supervisee, etc., in remedial or disciplinary proceedings, potentially raises the question about discriminatory motivation. And if you're going to have exceptions to a rule, make sure they're clearly defined and followed, right? So as Handelsman and colleagues wrote about a number of years ago, when we train our students from the first point at which they get into our graduate programs to they're getting that last hour of postdoc, it is an acculturation process. And it involves exposure to and a focus on instilling principled approaches ethically and a thoughtful approach by our supervisees and students, not to mention us. And the current ethics code, all of you know that it's under revision right now, but the current ethics code encourages us when there's a colleague and a trainee, an intern has made an ethical error, and I would argue that that's what happened in Ward versus Polite, according to the ACA, also APA code. But it's not so egregious as to warrant a formal complaint and procedure. We start with an informal resolution. Now, maybe that's more of an edgy one to think of the Ward versus Polite as being, more appropriate for informal. I could see reasonable minds differing, but let's assume that it's okay to talk about it informally. Well, 104 in our ethics code says that when we believe there may have been an ethical violation by another psychologist or by a supervisee, an intern, we try to resolve it by bringing it to their attention. And if it appears to be informal, appears to be appropriate, and the intervention does not violate confidentiality. Okay, so there's an enforceable standard around that, and that's one of my reasons. Although I also have very pragmatic reasons for, in the initial stages, really favoring the informal that nonetheless is documented anyway, so that we're trying to work with engagement, relationship, and alliance. What for everyone here as a psychologist, all of you, that's one of your strong suits, okay? It's one of the more important strong suits that you have. This is not simple. It seems simple. Well, we just deal with it informally. We'll talk about it. And in my experience, professionals don't get much training in this. This includes my never getting much training in it either. But I learned a lot from Jerry Kuchar and Pat Keith Spiegel's wonderful textbook on ethics for mental health professionals, psychologists, and mental health professionals. Uh, I think the last edition was 2016, so 10 years ago. But it was one of my standard texts in ethics and law classes. And they articulated that it's very important to prepare for these kinds of conversations. And to do that by taking a number of steps before you even get in the room or on the video chat call with the supervisee. Okay. And the first thing they recommend is if this is an ethical concern, as was the case with Ward versus Polite, that we identify exactly what the ethical consideration was. It's not unheard of for any of us to take offense, get really angry with, feel distressed by a colleague or a student, and perhaps by a widely divergent view or unpopular or a personality style. That's different than something being ethical. That doesn't mean you can't approach it. Interpersonal issues are relevant to our training process, but it would take the issue of the person being unethical off the table. And it's important to clarify at the outset, which one of these issues is it? This is the idea of define it, identify it, and define it. The second step they take is that we reflect on our own motivation. Am I really angry with the student? Were there some things that I felt uncomfortable with that I just said, oh, well, we'll develop a relationship? Are there some other issues happening for me at the moment? And it's not going to happen, necessarily a majority of the time, but sometimes our own reactions are going to be powerful. And if they are, it's really important to be reflective about that and consider also, are there any cultural issues at play? Are there any issues related to difference? Ethnic difference, linguistic differences, racial differences, in terms of power, but also in terms of just how each of it just develops in this soup of all kinds of different experience, right? So considering culture, how might it elucidate the supervisee's behavior from our perspective and my own reaction? Are there differences here? And even if you believe there aren't, it's a good question to ask, not just perfunctorily, but to spend a little time with it. Now, Kuchar and Keith Spiegel also encourage us to really take a look at the strength of whatever evidence we've had. If we directly observe the behavior, that's, of course, the strongest. Or the person says it to us and says, it's a disclosure about an ethical violation or something really problematic. Those are the two strongest ways of being able to say, okay, this is something we've got to talk about. If you are seeing what you consider to be suspicious behavior or potentially problematic behavior, but it's not clearly interpretable, that's weaker evidence. That doesn't mean we can't ask further, and in fact, we should. But it's not immediately going to, you made, Dan, an ethical error here. You were unethical in this regard. It does not, this evidence should not include just casual gossip. Do you hear about what Dan did last week? Okay. That would not fit this particular mold. Also, consider the nature of your relationship with the supervisee, how it's evolved and where you are now, because it may impact whether you're the appropriate person to approach them. And it may strongly suggest that you are or not, okay? And slow is smooth and smooth is fast. Reach out to a colleague and, this Yelp part, right? And talk to a colleague who you know is sensitive to the issues ethically, interpersonally, clinically. And don't just write something anonymous about the student. It makes people often more defensive, and it could, for somebody who's less scrupulous, allow them to plan for ways to avoid detection. So be really careful about that. Um, so still a bit on preparation. Schedule a meeting in advance and try not to use any kind of menacing or punitive tone. Um, and I strongly encourage in person, if at all possible, or video chat. Don't do this one via email or text. You all know, the potential for misunderstanding, miscommunication, problematic. Do this in person or at least video chat, okay? And approach this, if at all possible, with curiosity and constructively. You're trying to find out what's happened as well, the person's perspective, what their thoughts are. And you're not um, uh, somebody who's there to dispense penance, and you're not a prosecuting attorney. Okay. Even if you're feeling really offended and wanting to go after the person, that means you need to take a bunch of breaths and consult first. Even if they've done something super offensive and you're right about it, slow it down. Okay. And really, as best possible, view that conversation as a collaborative conversation at problem solving with the colleague. Almost everybody here has been in the room with a person with borderline characteristics or diagnosis. Very difficult. Use the skills you have about remaining calm and self-confident, and anticipate that the supervisee is probably going to get upset, may become defensive. As best we can, use non-threatening, even soothing language, expressing confusion or asking for clarification, and avoid accusations. At this point, you're looking to understand what happened, all right? If it's pretty clear it's an ethical problem and a violation, clarify your understanding of that. Be upfront. You're not trying to trap them into anything. You're trying to say, here's the problem that I see. And allow the person ample time to explain or defend their position. And anybody who's had this brought to one's attention knows we become embarrassed, sometimes defensive, repetitive. Give space for that. If you're doing this on behalf of other professionals, or let's say you're working in an internship program where you're somebody who has a good relationship with this supervisee, maybe you're not their primary supervisor, and you've been asked by the group of supervisors to address it, be honest about it. I don't have direct knowledge of this, but I did agree to talk to you about it, and on behalf of the training staff, for example. This is what, I understand happened. Could you tell me, what was your sense? What was your experience? Obviously, if the person becomes angry or attacking and attempting to calm down doesn't work, bring as gentle a closure but firm a closure to the conversation, and say, I understand you're upset. This is difficult. Let's stop and we'll schedule another time to continue the conversation. The flip side, though, and more in keeping with a lot of the tone for this afternoon, what if this particular complaint has been against you or me? Okay. How do we handle that? Well, obviously, we want to know the structure of the institution that we're in, if there is any such structure, and know whether there's an informal process, organizational rules, and be aware that with some exceptions, it is often really difficult for a supervisee to bring this to our attention. And I've met some exceptions to this rule, but it is generally the case. If we're approached by a supervisee or student about a complaint or a concern, or they think we've done something unethical, what I want you to do is slow is smooth and smooth is fast. Slow down, breathe, okay? And if possible, set up a time that allows you to first consult with a trusted colleague and choose someone who's knowledgeable about, if at all possible, the issue at hand. Is it disability? Is it a particular therapeutic approach that the supervisee is talking about? Is it gender identity in the third example that I gave you? Is it about possible race or racism? Or is it about attraction between the parties? religion. So trying to find a colleague who would be sensitive. It doesn't have to be somebody who's completely the expert, but somebody who's sensitive to that. And then in that meeting, the point is to listen fully, okay? Ask the supervisor about their experience and take the time to reflect on what you're being told. Just listening is not agreeing. And, if it's a wildly inaccurate accusation and it's really upsetting you, and your first impulse is, wait a minute, that's not what happened. Slow down. You will have time to respond. Listen fully, inquire more. You're not agreeing, you're listening. If the supervisee had been upset, as in the case of Vignette C, for example, by something I did, and it had to do with gender identity, I may feel defensive. Well, we're human. We're going to feel defensive. And it's hard not to just explain or defend. So be asking ourselves, is there something I missed? What can I learn in this situation? Okay. And really, what can I learn? And sometimes there's going to be nothing. It will really be a problem that's being brought to you that's not really your problem. But there'll be times where there are things we can learn. Give yourself time after this complaint or confrontation to talk about it with your trusted colleague before you respond. If you agree with the supervisee or student's point of view, say so. It's perfectly okay to apologize. That sometimes does what it needs to. But if you don't, you can say, well, I apologize for any distress I may have caused. That's not the same as saying I did something wrong, okay? And fundamentally, if you're ever approached by a concerned supervisee or student and they make a complaint, it is challenging. I know from my own experience, but see if you can find your way to being grateful for the information about how this person perceives you and how others may be perceiving you. And again, this can be painful. This is not a fun thing. The more we can openly and honestly work towards a positive outcome, including acknowledging if we've made a mistake, it can reduce the likelihood of there needing to be an external party who gets brought in, okay? Now, a caution about this: if a student or supervisee accuses you of something that you think you might have done, and it was not just mild or not something that was a misstep, go slow, be careful, get consultation. I don't believe you have to fall on your sword. And so apologies are often very helpful, but not in all situations. It may be good to talk to a colleague first and then get back and apologize and explain that you wanted to take time to consider what they said. So in terms of my concluding thoughts for the afternoon before I start entertaining questions, the goal here today was to help you enhance, reinforce, because I bet a number of you are doing a lot of these things, the experience that your students and your supervisees have in your classroom and your training, and to help reduce the likelihood of complaints and then manage them if they do arise. Again, and I know repetition here, our relationships with our students, the alliance, engagement, those are so potent. They're especially important. I believe in teaching, but even more so in a supervisory relationship. All right. Routinely invite feedback. Don't fight it, invite it. Beyond the end of the semester or placement evaluation, where the student is giving you an anonymous one. And do your best to adhere to the structure, especially when you're under pressure, slow and easy. Give, to the best of your ability, observable markers to students and supervisees regarding how they're meeting expectation for performance. We should give routine, frequent feedback based on observation, and use structures that we have in place already to resolve issues related to performance and performance improvement plans. and use structures for vetting complaints, initially informally if possible. Slow down, listen, and if we get somebody complaining against us with our dissatisfaction or a complaint, breathe and do your best to kind of put your defensiveness on hold and just listen for now. So I'm going to stop there, and I know that there are probably some questions, Andrea, that you have for me from the group, and so I'm happy to take those. But why don't we move on to those at this point?
Sure. Well, first, Dr. Taub, thank you so much for a very informative, engaging presentation. There are quite a few comments and then also expressions of gratitude in our Q&A box for this presentation. We'll start with, when you started, you described a real significant shift in student and supervisee expectations while emphasizing that faculty and supervisors still retain substantial power over evaluation, advancement, and then also access to the profession. So the question is, how do faculty and supervisors distinguish between a legitimate change in student expectations that training programs should respond to and an expectation that may actually undermine the educational or supervisory process?
Yeah, great question. I think the place to start here is, what is the program or training site? What are your goals and objectives? And what are you expecting with students? And does the criticism of the student support and potentially enhance that? Or does it seem to really be either tangential to it or potentially undermine it? So in my view, it comes back to a basic kind of review, not necessarily a reevaluation yet, but a review of what are we trying to accomplish here in our specific training site? And is the criticism directed at that? That can help, because sometimes, we will develop policies and procedures that work for a while, and then they don't. Or with some students, they really don't work very well and they need some modification or tweaking. That could be legitimate, right? But simply a student coming in and saying, well, you don't support me enough, I would want to know more. What do they mean? You should support us by allowing us to do our work from home because it's too much work to get into the center. Well, if your focus is on in-person or remote, and you require students to come in, there's a legitimate basis for that, right? You want them there with colleagues, a group, a kind of esprit de corps, a sense of being connected and accessibility to other providers. So I realize that your question is more complex and probably you could spend a lot of time talking about it, but those are the places that I would start.
Thank you. Many people noted that supervisors change every semester, and many times trainees keep their same clients.
Mhm.
So in terms of supervisory agreements, what should supervisors consider during the transition to a new supervisor?
Oh, that's lovely. I would try to find out what the prior agreement was.
Mhm.
So that what you can do is, if your agreement and your structure is different, you can highlight those differences. That helps not only the supervisee know that, not only are they in a different situation, but that the expectations have shifted. But it also helps you and me as supervisors catch things like happened with Mr. Intern, because he had an assumption. What my grandmother used to say to me about what assume does for you and me. But he had an understandable assumption that the rules would be the same in a different environment. And the agreement, if they'd use something like, it certainly doesn't have to be everything, had they had that and the training process highlighted, here are the ways you do reporting and we do or don't do, if the question came up before the person actually made the report, that's not the kind of a report you would make. That's some of what to look for in the differences between those agreements. Now, I want to add before, I know there are more and more questions growing, but I'll do my best. I don't want to leave the questioner in the lurch here. What happens when you have a prior placement where there either were none or very few agreements? And maybe it was unclear how the supervisee was supposed to approach the client. I think the best you can do there is by articulating your own, so that they begin and asking them to ask you any questions about the difference between the prior experience and the current one.
All right. Well, still staying with supervision and how to navigate some difficulties, can you speak a little bit to the scenario that sometimes happens where students who have gotten some difficult feedback start to present escalating, highly detailed, and confusing complaints, and then contest each statement or detail of concern?
Mhm.
It
Yeah,
can be hard to continue or move forward with the appropriate action without beginning to have it seem like a court of law with
right.
screenshots or phone calls, text messages, emails.
Yeah, yeah. Well, a couple of things. One is, if they have escalating complaints and criticisms, that's when I think we move to more formal processes and bringing our colleagues in. Okay. Um, Somebody who's not directly involved in the interaction needs to be observing and helping and documenting. In addition to that, if it's text exchanges and email exchanges and disputes, my encouragement here, even though you all have heard me be very, very heavily focused on have these documents in place, but I really think in-person meetings initially, and then with a third party, a neutral supervisor or a director of a training site, are ways to help keep that from happening, but also channeling so that if there are going to be complaints, they should be through a formal process. If the person is doing that, now we're in a court of law. Um, I do believe that if it gets to the point where there's that level of contentiousness, it may not be a functioning supervisory relationship anymore, and not at the fault of the supervisor. Okay, you may have done your best, and the student is a person with some significant personality disorder, or an overly strong sense of entitlement and about telling you what to do. If there's any option and the relationship comes to the point where all it is complaints, then I think it's time to consider shifting either the supervisor to begin with or possibly the placement.
Mhm. So, what if the problem is a student who's struggling with self-awareness and accepting feedback, having difficulty taking responsibilities for their errors, attributing problems to external factors such as instructors, technology? And
Mhm.
then, as a follow-on to that, the person's asking, and what if trust has been broken between the student and the faculty, and the student perceives that the faculty aren't on their side?
Yeah. Well, I'll start with that one first, but I want to get back to the first one, Andrea. I think very similarly to what I was saying in response to the last question, if the student and or faculty believes trust has been broken, in a classroom, they may still need to complete the class and complete the requirements, okay? Or they may have an option in some programs of repeating the class with someone else if they claim that they were not treated fairly. But it may mean, if trust is broken, that this supervisor with this person is not a good fit, or that you really can't provide continuing supervision. If you're required to because of the constraints of your environment, and then I think it's important to go back to a structured agreement and say, we need to kind of back up a bit here. And even though it may not regain trust, we're still in that training and gatekeeping function. And so that's one way to go about addressing the issue of trust being broken if there can't be a substitute supervisor or a different setting in which the student can get trained. But in regards to the first one, Andrea, can you repeat it again so that I'm not?
Sure. Yeah. So, what if a student struggles with self-awareness and accepting
Got it.
feedback?
Got it. Yeah. So this is one of the hardest ones, isn't it? Because self-awareness is so crucial to the work that we do. And I think this is important, um, one of those very important situations where we document each of the supervisory interactions and where the student has, essentially externalized the problem. It was AI, it was, the technology didn't work, it wasn't me. Because what you do is in that way, you're documenting a pattern of deflection of responsibility. And you try to give feedback, as I'm sure you've done, the person who's asking the question, that then kind of gets deflected, but it not only document the deflection and the externalization, but what you said in your attempts, right? And as that develops, let's say it's over the course of a couple of months that this happens, then you give more specific, or I should say, more kind of summarized, I wouldn't call it summative feedback yet, but summarized formative feedback saying, here's the issue that I see you having. I've noticed that when I give you feedback about something that you may have done, there seems to be a very distinct set of responses you have that it's usually not you. And I really want you to try to start reflecting on how might I contribute to this? And I assume for the sake of argument that the student continues with that particular very defensive and externalizing approach. You're having had the conversations, documenting them, doing them more than once or twice or three times over the course of a year will make it much more powerful for you to say they have not been able to develop or demonstrate a skill that is essential to being an effective clinician.
All right, so I'm going to switch gears a little bit and ask a question about classroom dynamics. It's related to some of the information that you gave at the beginning of the talk on attendance and participation and
Yeah,
how important that is in graduate level training. So can you discuss how you manage electronics in the classroom, specifically
yeah,
laptops and tablets? So the
yeah.
reality is that many students use devices to take notes.
Hmm.
They may not appear to be, but they often appear to not be attending or participating.
Right,
You
right.
evaluate students who are attending but not necessarily engaging in class.
Yeah. Um, so this is the one of the issues of our time, isn't it? And so um, I think that there are a few different strategies that one can use, and don't have the time to go all the way down that rabbit hole, but it's a really good question. And it is first, we have to give students something else to do than take notes. So request that they be active. Okay, I'm going to ask you for right now. I'm not going to. I don't want you to take notes right now. I want you to close your computers, and we're going to have a conversation as a group about how would you approach this. So you pose hypotheticals. You ask students to respond. You ask them to engage with each other in conversations. In some of our earliest classes for basic therapeutic intervention training, we have role plays with one student being a client and one student being a therapist with a particular defined problem that they're working on, non-personal to that particular student. And then we have them go back to their device and put in some notes about what did they get from it? What did they learn? But it's breaking up to the extent that we can, breaking up interaction activity with the passive taking in of information. So you're requiring participation. It's not simply, well, if you ask a question. And to me, that seemed to work relatively well. It wasn't perfect. And I know that there were plenty of people in my classes over the years who would, be on the computer looking up at me, looking like they're involved. And then I'd get another student coming to me saying they were upset because the person who was looking up at me was actually playing a game during class. So then I bring it to the class and I say, I know it can be hard, but I'm going to ask everybody to not be playing games on their computers, not be texting with their friends. And that's part of the rule. And if that happens, I will ask you the first time, maybe the second time, to please stop. After that, it's going to affect your grade.
Yeah. Oh, great. Thank you very much.